The following is a paid program. The opinions and views expressed do not reflect those of Bloomberg LP, its affiliates, or its employees.
The following is a paid program that is paid for by Planet TV Studios.
Welcome, I'm William Shatner. Business and new markets can open new opportunities and new doors. Let's discover new frontiers in business with this story.
Today, we are visiting myfreedombank.com in beautiful Colorado with financial advisor Mark Solomon and author of Stop Being Poor. We were excited to learn what Mark is doing in shifting mindsets on money, banking, and finance. MyFreedomBank.com is setting new frontiers in how people think about money. We are here to find out what the buzz is all about and why Mark's unique message is so different.
Why do something different? Ever since 2008, people have realized that they can lose a significant amount of money in their savings and retirement incomes. I'm going to suggest a radically different way of thinking, and it has to do with how you think about money and cash. There are three primary misconceptions people have about money. The first one is that you have to borrow money from other people. The second is the only place to save money is in a commercial bank or on Wall Street. And the third one is that you have to expose your savings to high risk and the possibility of loss in order to get ahead.
My Freedom Bank's philosophy on earning money is to place savings in something that always has gains, not subject to the ups and downs of Wall Street. We were anxious to hear from Mark on how he's teaching others how to leave the system.
You probably never thought of using a life insurance policy for savings and for loans. Most of us use credit cards or bank loans for cars or appliances or for trips or anything that we need to buy. But that gets into losing money again, losing interest paid to others. When we build up money in a life insurance policy over time, we have access to parts of that as collateral that we can take a loan out against. Every year, you put money into that life insurance policy as a premium. Part of that premium becomes available to you as a cash value. Now, that cash value can be used as collateral for a loan. That is, you can take out a loan for as much cash value as you have. The interest you pay on that loan doesn't go to somebody else. Because remember we said this is from Mutual Insurance Company? This is a company that you are part owner of. And instead of that interest going off to somebody else, to one of a company's stockholders, it goes back into a company that you're part owner of. And guess what? If that company does well, does better than it expects to, you being a part owner will then benefit from part of that success. So what we like to say is that you're able to recover the interest you would normally pay to others, thus dispelling the illusion that you borrow money from others and lose money to them in interest and fees.
One of Mark's unique philosophies on finance is that if people treat themselves, their families, and their business with the same respect that they give creditors, they will end up on top. We wanted to hear Mark's thoughts on how this is done.
Let's talk about the difference of accessing your money using privatized banking versus a credit card or a bank loan. You can access as much cash value as you have as collateral to take a loan out. You don't have to fill out any papers, ask for any permission. You can use the money for whatever you want. And the big difference between that and every other way of borrowing money from other people is that you decide the terms of paying back the money. Now try doing that with any other kind of bank loan or a credit card. When you borrow money, since you don't have to explain what it's for, you can use it for anything. If it is for a major purchase, if it is for education, if it is for a vacation, or it could be for a real investment. Not a passive investment, but an investment whose risks you understand and know deeply. So whether it's a hot stock tip or the best friend's next door's business, the next big thing, you can make that choice. If it's your own education, if it's your own business, you can make that choice. But it's always important to remember that you must treat yourself as you would treat any other bank and understand how you're going to pay back your money with interest so you don't cheat yourself.
After visiting myfreedombank.com and interviewing Mark Solomon, we discovered that Mark's privatized banking creates new frontiers in the way people achieve financial freedom. To learn more about Mark Solomon and how privatized banking works, please visit myfreedombank.com and check out Mark's book, Stop Being Poor, on Amazon and Audible.
Markets and opportunity are evolving every day. Let's discover new frontiers in business with this story.
In today's world, many individuals and families find themselves unprepared for the cost of long-term care. Some people are diagnosed with very serious conditions, while others may want to try a cutting-edge treatment that their insurance won't cover, but they don't have the money to explore these options. Moreover, many seniors have found themselves with changing estate needs after the death of a spouse, divorce, or upon retirement from business. Rising premiums can cause life insurance policies to become unaffordable. And before now, many thought their only option was to surrender the policy or allow their policy to lapse. Founded in 2002 by Blaine Cook, Montage Financial Group began offering an alternative financial strategy for those considering life settlements. A life settlement is the transfer of ownership and beneficial rights of a life insurance policy in exchange for a cash payment. Cash received is based on a percentage of the policy's face value or death benefit. Montage Financial Group facilitates the sale between the policy owner and the investment community.
I formed Montage Financial Group in 2002. What I wanted to bring to the life settlement industry was structure, a way to trade in a platform that made sense. I also wanted to bring a level of security to the insureds, knowing that their medical information would not be out on the web someplace or have their social securities taken, numbers taken, or anything else of value that's in their medical files. And so we were able to give investors good value for their money and also give the selling client a good cash payment at the end of the settlement process.
As we explore the many facets of a life settlement and how Montage Financial Group completes a transaction, it's clear that most potential clients have a limited knowledge of this marketplace. Many insureds aren't even aware that their life insurance policy is a marketable asset that can be sold. Since life settlements aren't affected by market fluctuations, they can be a good wealth management strategy. Some of the top investment firms have aggregated portfolios of life settlements.
Well, it's interesting that even the insurers have gotten into this space. AIG, for example, in a $2 billion portfolio that they've accumulated, has a large portion of that in the life settlement space. Apollo, Blackstone, Berkshire Hathaway, they're all in this space too. Investors move to where money can be made.
You may be asking yourself, what is the next step if I want to consider a life settlement? First, your eligibility needs to be determined. Montage Financial Group works with many of the top underwriters firms. These certified underwriters will determine the life expectancy of an individual based on their age, gender, lifestyle, family history, and medical conditions. After a policy is evaluated and if the policy meets an investor's criteria, the policy owner and their representative will be notified and a cash offer would be negotiated.
As a licensed life insurance agent, I've helped numerous clients life settle their insurance policies. As a representative who deals directly with both insureds and policy owners, I rely on companies like Montage Financial Group to help me obtain market offers that I can feel confident presenting to my clients. Their staff has years of experience. They care about people, and they want to make sure everybody walks away from the transaction happy.
Montage has processed more than $15 billion in life insurance, and each person on the acquisition team has more than a dozen years of experience negotiating and aggregating life settlements. Montage's longevity has created quality relationships, offering efficiency and professionalism for all parties involved.
In a recent transaction that Montage closed, the insured was deciding on whether they were going to sell their home or sell their life insurance policy. They needed to pay $200,000 of medical bills that they had acquired due to a costly pancreatic cancer battle that they were going through. The cash surrender value of the policy was zero. Montage was able to monetize an immediate $200,000 cash, so the insured could pay for all of their medical bills and keep their home.
The thing that's so fulfilling to me in this business is that we can take a situation where somebody might not get anything for a policy that they've been paying on for 10, 15, 20, sometimes even 30 years. And we can take a situation and monetize an asset they didn't even know had value. And that's so fulfilling to me. That's what makes me so happy that we're able to give people millions and millions of dollars for an asset that they may not even know had value.
In 1789, Benjamin Franklin was quoted writing, "But in this world, nothing can be said to be certain except death and taxes." Montage Financial Group understands that. Call them toll-free at 877-609-7700 to learn more about life settlements and visit them online at www.montagegroup.com. Montage is a proud member of the Life Insurance Settlement Association, LISA, the oldest and largest trade association in the life settlement market. The Life Insurance Settlement Association serves to help connect the life insurance settlement industry through educating consumers and industry professionals engaged in life settlements. LISA puts an emphasis on its membership to abide by a code of ethics and standards of professional conduct.
The opportunity to make this world a better place has never been better. Join us today in discovering those that are making a difference in our world.
Today, we will be visiting St. Louis, Missouri to learn more about cutting-edge financial strategies being created by the team of financial professionals at E3 Wealth. They believe that storing money in the traditional banking system is no longer a viable option for conservative savers and entrepreneurs in America. We wanted to understand why E3 Wealth feels the traditional banking system is failing Americans and learn how they're helping people think differently on how to manage their finances.
E3 was created to help challenge the status quo as to how Americans are educated about money and finance-related decisions. And through our research, we came across Nelson Nash and infinite banking concept, and we basically figured out that this has to be part of the core education that we give clients, not because it's better than the banking system or it's better than the stock market. It's really more of, if we talk to our clients and understand the purpose of their money, this is a really good fit, and this is a great place to store their wealth that they want to plan on utilizing. And for a lot of people today, once they're educated and know that there is a place that they can store money, and whether you want to look at it as your own privatized banking system or your own infinite bank, the concept isn't the banking part. The concept is utilization of your money.
E3 Wealth believes there are two types of returns that people can earn when growing their personal or business economies. We wanted to hear more about what these two types of returns are based on and how they interact with each other.
There's two main types of returns: internal returns and external returns. Internal returns are the returns that the asset actually creates. So a stock or a mutual fund, its internal return might be the dividends or interest it pays and the appreciation that it earns. External return is something that people are familiar with, but they don't really think of it as a return. So an external return might be when you save money on interest paid to a bank or credit cards, or you pay off a loan and now you have X number of dollars every month freed up. When you look at life insurance or specially designed life insurance contracts as part of your privatized banking system, that is a unique asset that has the ability to help you create both an internal and an external return. It now becomes this ongoing strategy, this ongoing process, really a system that allows their money to work for them allows them to maintain control over the assets, but leverage the returns in a way that they really never thought possible. Our conversations with whether it's individuals or families or business owners, entrepreneurs, is if we can educate you on ways to think differently about your money and introduce you to strategies. To me, that knowledge is not just communicating to clients and say, this is what you should do. It's actually building the relationship with the client and the client saying, yes, thank you for teaching me about these types of strategies. So I didn't have to change the way I think about money. I get to change the way I use.
For a lot of years, we invested traditionally, like a lot of people do, through traditional means, whether it's IRAs, 401ks, anything of that measure, and we always wanted more. So we were always asking people for more. How can I do things differently? How can I create wealth in different ways? And the answers weren't always so clear. And everybody had some different formula, but they all sounded the same.
E3 Wealth believes the financial service industry has done a poor job educating the public, and the results have caused individuals, families, and business owners to lose faith in the value that good financial advice can provide them. We found that one of the secrets to their team's success was putting their clients and community first. Unlike most financial institutions, E3 Wealth will work with anyone, regardless of their occupation, net worth, or financial objectives.
E3 Wealth has almost 30 plus advisors that are in multiple states, and they all want to be very successful. The best way to be a successful financial professional is to make sure that your clients are successful. And so that symbiotic relationship that we have, we believe it starts with educating the client, looking at ways to empower them so they can take control of their financial picture, and ultimately enlighten them in ways that they realize whoever they were before they met us, now they're in a much better place because they can see what they're able to do with their dollars. And to us, that is why we operate our business model the way we do and implement strategies like the infinite banking concept.
After visiting E3 Wealth in St. Louis, Missouri, we found their team of financial professionals are creating new frontiers in educating people to think differently about their personal and business economies by going outside the traditional financial systems and using the infinite banking concept. For more information about E3 Wealth's resources and how to take control of your financial picture, please visit e3infinitebanking.com or e3wealth.com.
From time to time, an individual or an organization rises up to make a difference in this world. Let's discover and watch now those making a difference.
Privatized banking is a new phenomenon that is helping individuals control their own money and finances outside of the standard financial institutions. Today, in Wilkes-Barre, PA, a company called Tier 1 Capital LLC is showing individuals how to do privatized banking and minimize their risk when managing their finances. We are excited to see how Tier 1 Capital is shaping new frontiers in banking.
Privatized banking really is all about making your money more efficient. We start by eliminating some of the losses or the transfers of our money in the form of taxes, interest, fees, and market losses. And from there, we combine the concept of saving with the concept of borrowing. In the process, our clients are able to regain control over their money and, more importantly, over their cash flow. It always becomes an issue where sometimes they get out of balance, where they have too much debt and they're constantly digging themselves out of financial holes. But basically, if we combine the concept of saving with borrowing, your money is always earning interest through the saving component, and you're maximizing the efficiency of your own money by using other people's money in a more efficient way.
Making wise choices can affect where an individual lands in the tax bracket. Tier 1 Capital believes that the best way to get ahead is financial decisions that lead to the minimum taxes owed. We wanted to hear what options privatized banking could bring and how much money an individual could save in fees and taxes.
So if you're following conventional wisdom, your money is constantly in the market, your money is constantly in areas where you don't control, and most of what you don't control is the area of taxation. And what people don't realize is taxes could take as much as a third of your savings and investments. And that has a devastating effect on your ability to accumulate wealth. We always say that you cannot accumulate wealth in a taxable environment. So we always look for tax-efficient ways to save money. And consequently, we eliminate or greatly reduce the ability of the effect that taxes have on creating a nest egg.
After interviewing Tier 1 Capital financial experts, we learned that their financial advisors believe that a secret to earning wealth is an uninterrupted compounding of interest. They believe that market losses, taxes, excessive fees, and other unwise options prevent most people from earning compounding interest.
We think that compounding interest on your money is a good thing. And we always ask people 3 questions before we present anything to them. Number 1, do you believe that compounding interest on your money is a good thing? If they say yes, then the next question is, if you think it's a good thing, how soon do you want to start? And they say immediately. And then the next question is, if it's a good thing and you want to start as soon as possible, when do you ever want to stop? And they say never. So unfortunately, life sort of gets in the way. And when you start doing things from a conventional wisdom, now all of a sudden you got to start over saving again. And what happens is the compound interest curve becomes longer and flatter, meaning that you're going to lose those end years of compounding.
Many people get confused on how to manage their money in the long-term picture, don't have a plan, or just simply can't seem to get ahead with interest fees, banking fees, and taxes. We found that the Tier 1 financial team puts together a custom financial plan for each individual so they can get ahead and start earning the interest they deserve.
So in building plans for our clients, we try to we make their money more efficient. But how do we do that? Well, we get multiple duty dollars. You get $1 doing several jobs. If we can get $1 that previously, let's say you were utilizing to pay off debt, and get that dollar to pay off debt, build an asset, provide a death benefit, help you pay for your children's college, we've just made $1 do the job of $3 or $4. And that's how we make our clients' money much more efficient. And by doing that, we add to their bottom line.
After visiting Tier 1 Capital in Wilkes-Barre, Pennsylvania, our investigative reporting found that privatized banking is creating new frontiers in the way people control their finances and secure their future. For more information on privatized banking, please visit www.tier1capital.com.
Internet technology and companies have been changing the way we do things for the last 20 years. Let's discover new technology and how it's changing our world.
The world of managing finances can be challenging and requires a long-term plan for success. Today, we are excited to visit with Eisner-Amper Wealth Management and Corporate Benefits, located in Iselin, New Jersey, to learn about new frontiers that are being created in the world of wealth management. Eisner-Amper Wealth Management and Corporate Benefits has created specialized processes and uses technologies that allow their clients to plan for a financial future with behavior analysis and a state-of-the-art wealth management tracking system. We are excited to learn about these new technologies and what makes their system on the cutting edge of wealth management.
When we created our wealth management division, we wanted to connect with our clients in a more meaningful way and truly understand that which is most important to them. We have a diverse clientele, which includes business owners, high net worth families, as well as divorcees and widows through our Women in Transition practice. All of these clients have individual beliefs around what money means to them. The technology is at the foundation of our planning process, helps us and helps our clients understand the behaviors around money, and also, more importantly, helps us answer the question that we all want to know. Am I okay? Am I okay for retiring? Am I okay to buy that house? Or am I not going to be a burden to my family? And lastly, do we want to leave assets to our children? How much can we leave, or do we want to leave? These questions and so many more are the questions and answers that our clients are seeking for that we deal with on a daily basis. It is amazing to see how complex financial lives have become, and our tools strive to make sure that their financial planning needs are unfocused.
Managing finances and planning for the future can be complex and frustrating. Many people struggle with balancing the decision-making process. This includes spending, saving for the future, or planning for a future estate. We are excited to learn that EisnerAmper Wealth Management has created technology to help their clients understand their financial choices and the impacts that result in getting the desired financial future they are looking for.
Helping clients think differently start with how we engage them. Our interactive tools and planning process make finance more human and less intimidating, bringing clients into the practice as active participants and educating them each step of the way so that they can feel more confident about the decisions affecting their goals. Whether it's asset management, risk management, or corporate benefits, our team of specialists allow us to address a broad range of needs for both our individual and corporate clients, pulling together the appropriate team to address our clients' vision. Once a plan and roadmap have been jointly created, our technology provides for on-demand access, day or night, to progress reports for the goals that clients told us were most important to them.
EisnerAmper LLP was founded in 1965, and through its affiliated wealth management company, they promote cutting-edge technology developed for long-term financial management. After interviewing the team at EisnerAmper Wealth Management, we found that their leadership in finance is more than capable to map out a wealth management plan.
We understand that life is only getting more challenging. Our ability to make the complex simple for clients is what we strive for here. Client education and interactive engagement enable our clients to gain better clarity, confidence, and control where life intersects with their wealth. Our technology facilitates honest discussions to uncover and prioritize the client's values. If one of my women in transition clients said to me, "Jen, it's really important to me that my son go to the best private school around," then I might say, "That's great. Just understand we may have to evaluate the purchase of that beach house you've been looking at." That's a trade-off.
The technology and tools available to their clients are incredible, incorporating FinLife partner technology. The EisnerAmper team assesses individuals or couples' finances through a method called the advocacy process. This unique technique analyzes financial behavior through a method EisnerAmper Wealth Management developed so they can better understand their client's financial identity. Their follow-up system is software that continues to allow each client to track their progress to make sure they are on target with their financial goals.
Planning is not as easy as just going from point A to point B in a linear fashion. We recognize this because there's always will be obstacles and challenges along the way. We want our clients to live their best possible life, and through our advocacy process, clients understand the resources they have to do just that.
After visiting the EisnerAmper facility, our investigative reporting found that not only are clients guided by a team of experienced wealth managers, but through the incorporation of technology, clients have an instant on-demand review of the items that are most important to them.
This is William Shatner. Join us next time to explore new frontiers and find individuals making the world a better place.
You can get Plexiderm for up to 50% off. Order yours at plexiderm.com or call the number on your screen.
The following is a paid program. The opinions and views expressed do not reflect those of Bloomberg LP, its affiliates, or its employees.
The following is a paid program that is paid for by Planet TV Studios.
Today, surgeons are discovering less invasive procedures every day that are safer, quicker, and extending life. Join us as we discover the latest doctors who are leading the way in spinal surgery.
We are traveling to the Cayman Islands to learn about an innovative new spine procedure, an alternative to fusion for patients suffering from leg and back pain. It's called balanced back. Much like a hip or knee replacement, the surgery restores the natural function of one or more low back joints, allowing patients to move and balance. Could this be the future of low back surgery? Our team aimed to find out.
This procedure is the first to allow the removal of the compressive problems in the low back. This is from a posterior or from the rear, and it allows the nerve decompression, and the implantation of a mobile device resolves the mechanical problems and reestablishes stability for the spine.
The balanced back procedure uses the latest innovation in medical technologies with a safe surgical approach to relieve leg and back pain. Rather than fusing your spine with screws and rods, the balanced back procedure stabilizes your spine, preserving full natural motion. Balanced back replaces the function of the whole joint, allowing total freedom of movement and flexibility.
This X-ray demonstrates the results of Mr. Barnes' immediate post-operative results. It shows that we have had surgery at 2 different levels, and the device is intended to treat 1 or 2 level disease anywhere in the lumbar spine.
The Cayman Islands offers patients both world-class medical treatment and a first-class restful recovery in paradise. This is truly concierge care, where each patient can take care of their body surrounded by family and friends in one of the most beautiful vacation places on the planet. During our investigation in the Cayman Islands, we wanted to find out directly why they are leaving the comfort of home for a spinal procedure.
With this leading-edge technology, we also are trying to incorporate a real holistic approach to health care. That includes being in an environment that allows the family to be present with the patient in a very warm, relaxing, and healing atmosphere. They can go out and sit on the beach. They can breathe the salt air. They can have the ability to have meals as they desire. So this healing environment includes more than just a successful surgery.
Yeah, I think, one of the things that I found particularly valuable here is getting to know the family. I mean, that's always our attempt, but in the clinical setting, sometimes it's a bit more sterile. But in this environment, we can hear their dreams and their aspirations and their fears and actually potentially address them in a way that's not really doable in the clinic setting.
So I went to the Cayman Islands. I had my surgery there, and Dr. Hodges was there, and Dr. Humphrey was there and came from Alaska. And so I had my surgery, and that night when I woke up from anesthesia in the middle of the night, I had absolutely no back pain whatsoever. It was amazing. The back pain was gone. And then the next morning when the doctors came in, they all came in there, and I guess they expected to see me kind of laying back and instead I said, "Good morning, how's everyone this morning?" They could not believe it. They started laughing. They could not believe that I was up, feeling great, no pain whatsoever. It was amazing.
Since launching this innovative back procedure, other allied health professionals from all over the world are coming to hear how this solution can help their patients back home. We had the opportunity to get firsthand feedback at a Balanced Back Referral and Rehabilitation Network continuing medical education course at the Westin 7 Mile Beach.
I've been a pharmacist now for 25 years. I've had a significant amount of time around patients who have had issues with pain. I've known patients that have had debilitating pain. I've known patients who have had just aches and pains. As far as the journey goes, I personally think that you should go to where the care is the best. And regardless of whatever the government approves, I think you should go to where the care is the best. I think that in this age of vacation medical, I think it's in the right way. If you can't get the care that you need where you are, you should go to where you get the care that you need.
Traveling for care might not be for everyone, but it is an emerging trend, particularly when advanced technology is available at lower cost outside of the United States. As more data emerges highlighting the downside of lumbar fusion, patients are increasingly searching for alternatives. We found one in Paradise.
The specialized field of spinal surgery is always improving. Doctors continue to improve procedures and outcomes. Join us as we learn about these stories.
In today's medical world, as technology advances, patients have new options for surgeries that are less invasive and quick recovery times. Today, we're reviewing a new surgery called extreme lateral interbody fusion. This back surgery is for patients who have reviewed other options, such as medication, massage, or physical therapy, and still have tremendous back pain. Surgery is reserved for those who do not gain relief from non-operative forms of treatment and patients that have symptoms that are increasing.
Back pain is the number 2 reason why patients go to a physician or a medical provider. When you look at it from an economic standpoint, the productivity lost for patients from the workforce that has back pain is in the billions of dollars every year. So there's a significant problem with regards to patients that have back issues. The XLIF procedure is an excellent opportunity for us as physicians, as surgeons. It allows us to remove the disc and free the nerves up and then stabilize the patient.
When a patient requires spinal surgery as recommended by a physician, the doctor may recommend the XLIF procedure as a good option. Some examples of those who may be candidates for the procedure include patients that have bad alignment, degenerative discs, slippage of vertebrae, or change in normal curvature of the spine prior to surgery.
It's important for patients to understand what their problem is. I'm able to sit down with the patients and show them the MRIs, show them the CAT scans, show them the x-rays, explain to them why they have a problem. In addition to that, I use a program called the Better Way Back program. This allows my patient to talk to other patients with regards to their condition, other patients that have had the XLIF procedure.
Extreme interbody lateral fusion, or XLIF, is a minimally disruptive surgical procedure performed through the side of the body. Using patented nerve monitoring technology, the surgeon gains lateral side access to the spinal column, avoiding any major nerves in the area between incise and the spinal column. The XLIF procedure does not require the back to be exposed and therefore minimizes the risk. It avoids the need for removing the ligament, tension bands, and muscles, therefore keeping the alignment in place and not disrupting normal anatomy.
The XLIF procedure is a minimally invasive procedure for a patient. It offers the patient to undergo major stabilization, but a minimally opportunity for the patient. Once we get into the corridor of where we need to be, we then can remove the disc and free the nerves up and place a form-fitted graft in the region to allow the stabilization to happen. Patients want a minimally invasive surgery. It's beneficial for them. There's less anesthesia time. There's less blood loss. There's less time in the hospital. And also, it's a quicker recovery.
Using this minimally invasive surgery has a tremendous impact on the patient. Patients usually feel an immediate relief after surgery and do things that could not be done previously. The XLIF surgery can have a life-changing experience where tremendous pain and lack of mobility can be completely halted. Patients have the peace of mind knowing the surgery is minimally invasive, can have quick recovery time, and find tremendous relief of pain.
I was on the first season of The Ultimate Fighter, and I ended up having a really good run in the UFC. I had my first 3 fights were first-round knockouts, and then I was offered a title shot, and it went really well for my opponent. Ended with first-round knockout. But after that, what made it even worse was I went from preparing to fight a 5-round title fight to not even being able to pick up my little girl, who was 5 years old at the time. And I remember it so clearly, her running up to me and saying, "Daddy, Daddy, pick me up." And I just said, I can't. At 35 years old, I wasn't going to get a second chance at this. So opting to have this surgery and then coming out on the other side with a back stronger than ever, for me, it was XLIF. Coming in from the side, minimally invasive, gave me my life back. That's why I recommend you go see a surgeon such as Dr. Hunter. This is a doctor who's been doing the XLIF for so long and utilizes the Better Way Back.
Prior to surgery, it was excruciating pain in the lower part of my back. The right leg would go numb, which caused problems with difficulty with balance, walking, trying to do my job. He has a team that is beyond reproach. They answered all the questions. They said prayers with me before they put me under. I mean, I couldn't ask for a better team. They had me completely relaxed, not scared to death, and knowing I was going to wake up on the other end being fine. I wanted my life back is what I wanted, and Dr. Hunter gave it back to me.
In addition to providing this life-changing surgery, Dr. Hunter provides training to other surgeons who would like to use this procedure in their practice. Dr. Hunter routinely does conferences and discusses the latest technology in regards to the XLIF procedure. This new technology and surgery technique gives opportunities for surgeons to learn the latest techniques.
Advancement in spinal surgery technology is constantly improving. Surgeons continue to improve procedures and outcomes. Join us as we learn about these stories.
As many seniors age, a common unknown occurrence that often gets misdiagnosed is spine fractures. These spine fractures often go untreated, and many patients self-diagnose them as back pain problems. Through our investigative reporting, we discovered that these spine fractures can be treated and that patients do not have to live in pain and can live a much more active lifestyle. Dr. Beal, located in Edmond, Oklahoma at Spine Fracture Institute, utilizing a minimally invasive procedure that's saving lives and helping patients live a longer life.
Spine fractures are exceedingly common. There's about 750,000 per year. You'd find that about 1 in 7 people have fractures. And the vast majority of these people will be asymptomatic. They won't know that they will have fractures. They will have fractures that are not painful. The other component and the cognitive dissonance of this is there are some fractures that are incredibly painful. If you have some fractures that let's say it presented with a 7 out of 10 pain or more, if the patient has pain and it's moderate to severe, especially moderate to severe and increase, and they need to be treated. And if patient has low pain or pain that's improving, perhaps they don't need to be treated.
We discovered that these injuries often go unchecked and can be easily missed on an X-ray. Close to 65% of all fractured spines are missed on X-ray and occasionally missed on MRIs. Many people with this injury suffer in silence, feel they are stuck with severe back pain, and that nothing can be done. Many times, general practitioners prescribe pain medication and bracing, not knowing how to properly treat the patient.
We often get calls from family members just looking for a solution. They will say that my mother has a severe back pain, and so we investigate a little further, finding out that they might be in that typical age range, over 65, with severe onset of back pain that is not normal in an older adult. Often the patients will have seen different types of physicians. Their primary care, they might see an orthopedic surgeon, they might see a neurosurgeon, and they're told that there's not anything that they can do. Without the education and knowledge that these fractures will not heal in an older adult, the patient will just then go home and rest, and the longer they lay in bed, the more loss of bone density that they get, the more fragile they become. So the patients then will lie there in bed and have issues with pneumonia, pulmonary embolism, and even heart attacks and death, waiting to have a solution to their pain.
When we visited the Spine Fracture Institute, saw the surgery, interviewed the comprehensive staff, we learned the patients that suffer with spine fractures can be treated quickly and have a life-changing experience. The procedure is called kyphoplasty. The surgery only takes 20 to 30 minutes, and the recovery time is only 30 minutes to an hour. Then, the patient is ready to come home. Patients that couldn't walk because of severe pain or were bedridden have the ability to walk in a short period of time after the surgery.
This procedure, although it's been extant for a little right around 20 years, has consistent improvements in technique, consistent improvements in materials, consistent improvements in introducing new technologies such as implants. And in fact, our site was the single best site and significantly better than the other 23 sites in terms of improving patients' pain and increasing their function. So the response, the typical average response, is a very dramatic response to kyphoplasty. The patients tend to be tremendously satisfied. We get them out of their downward spiral deconditioning. We get them back up and around. We get them moving again so they don't die of deconditioning.
When we reviewed the patient information, we discovered the Spine Fracture Institute has demonstrated superior results and has an amazing track record. Dr. Beal and the Spine Fracture Institute has had a near 100% success rate in recovery with life-changing results. The procedure often changes the lives of loved ones and family, knowing that the one they care for doesn't have to suffer anymore.
A doctor picked it up on an x-ray that I had cracked vertebrae because I didn't know what it was, but I couldn't walk. And so at the time that I was in contact with the folks here, they immediately got me in on a Monday, and they had to literally wheel me in a wheelchair because I couldn't walk. And they started the procedure about 9 o'clock in the morning, and by 3 o'clock I woke up and I could walk. And it was just absolutely amazing, the difference.
I've probably pre-oped hundreds of Dr. Beal's kyphoplasties before my own mother herself had a fracture. I noticed she was having lots of increased pain in her back, difficulty breathing, and just not herself. So talked her into coming down and having a scan, and she was fractured. Amazingly, after it was over, she was ready to bounce back. She was back walking like she was, going shopping like she was. Everything was back to normal after she was fixed, after her fracture was fixed.
My daughter had just started working for Dr. Beal, so she insisted that I come down here. I thought I had pulled my back. I picked up a heavy object, and then after I had the procedure done, it was immediate relief. I mean, I walked out of here. I didn't even want the wheelchair.
This important procedure changes lives in a monumental way and also saves lives. A patient that was once bedridden or hindered by tremendous pain can now walk and live pain-free.
New surgical methods and technology can make the process of surgery easier. Join us as we discover surgeons using breakthrough technology.
Today in America, a majority of people will experience severe back pain at some point in their life. For those that have back pain, 7% may evolve into severe back pain, which may include symptoms of having a hard time walking, too much pain to sleep, and too much pain to move. Not only does severe back pain affect quality of life, but it can develop into other medical symptoms. Today, we are talking with Dr. Hyder, located in Munster, Indiana, with an innovative back procedure that's helping patients walk out of the outpatient clinic pain-free.
The ideal patient is someone that presents with back pain caused by instability, who has failed conservative management. That's the most important thing we can stress, is that they have failed conservative management, because almost the majority of patients that we see in the office can be treated with physical therapy, anti-inflammatories, injections, chiropractics, and the majority of them do get better. So when a lot of people hear the name surgeon, they automatically think that they're going to wind up with a surgery, which is completely untrue.
Our investigative reporting has discovered a new medical procedure by Dr. Hyder that's quickly changing the lives of those suffering with debilitating back pain. After speaking with Dr. Hyder and his team, we discovered this procedure is minimally invasive, has quick recovery time, and is on the cutting edge of back surgery procedures. Patients properly treated do not have to live in severe pain and can return to a normal lifestyle in a short period of time.
The technique that we're going to be using is a minimally invasive approach called an MIS TLIF. So briefly discussing the transfemoral in-body fusion performed in a minimally invasive way. If you look at the traditional open fusion decompression, it's performed with a midline incision. Now, the way we are going to be performing the surgery is making 2 small incisions, about 3 centimeters on each side, and dialing in with some tubes and doing all of our work through this opening, where we go ahead and make room for the nerves and the spinal canal. And then what we'll do is we'll tilt the retractor so we can visualize the other side. The procedure itself lasts about an hour to an hour and a half, and most of our patients can be done in an outpatient setting and to go home the same day.
Dr. Hyder is not only helping patients become pain-free, but also invents and develops new spinal technology. In addition to inventing this technology, Dr. Hyder also makes improvements and recommendations to existing spinal procedure technologies. These innovative procedures and cutting-edge technologies are finding their way into medical journals all over the world, and Dr. Hyder was recently awarded as the #1 best-of-region spine surgeon. Dr. Hyder's innovative spinal surgery is taking the fear out of having this type of back procedure due to quick recovery time, minimal pain, minimal blood loss, and can be done in an outpatient setting. Patients we talked to were surprised about how quickly they recovered and were happy with the overall results.
Well, actually, I was going to get surgery by another doctor. My girlfriend suggested that I do much more research on who's going to do my back surgery, being that she had neck surgery and didn't go well. I looked around at probably 15 different doctors, wound up coming here because the consensus was that Dr. Hyder was one of the better surgeons around. The fact that he does it minimally invasive, and the success rate by the patients that I talked to, they were all really happy with the outcome. And it just got to the point where I couldn't walk anymore. In fact, I was at a grocery store, bent down, pick up a few cases of soda pop, and I couldn't get back up. In fact, they had to carry me out of the store. Got better after a couple days. I couldn't hardly walk. At that point, it was time. I had to get something done. But after, I think it's 6 weeks now, I can walk great. Hell, I could probably run if I wanted to.
To see what he brought with him as far as minimally invasive procedures and the time frame that it took to do surgery, the limited blood loss. I was completely amazed. The patients went home the same day. Today's procedure was 44 minutes and will do very well. Now that I am his office manager, I'm actually able to see patients come in prior to and see the pain that they're in, see the deficits, see the complaints and what they have, why they're there to see him. And so once I've seen them, I get to see them come back from surgery and how their pain is relieved, how happy they are. There's so much appreciation for those patients when they come back.
Becoming well known in the medical community for this procedure, Dr. Hyder provides seminars and training to surgeons around the world to teach doctors about this new spinal surgery. Dr. Hyder frequently has the opportunity to share his methods and technologies to expand his knowledge with the medical community and is changing lives every day all around the world.
Hello, I'm William Shatner. Thank you for joining us today. The opportunity for athletes to be healed after they've been injured has never been greater. Join us as we learn about new advances in sports medicine.
There are more options available than ever before for non-surgical management of sports injuries. Today, we are visiting Austin, Texas. Dr. Thomas, a leading-edge orthopedist, is leading the way in sports injury medicine by offering minimally invasive solutions that do not require surgery. Although Dr. Thomas can operate on patients, he works hard with his patients to find solutions that are non-surgical. Dr. Thomas's practice has over 20 years of specialized study and dedication to the treatment of sports injuries with non-invasive approaches.
And in general, most of the surgical treatment that I do is kind of like the last-ditch effort. In other words, I always look to see if there's non-surgical management or a minimally invasive injection that can be done to help improve people's symptoms rather than a surgery, because life gets in the way, people's jobs are too restrictive, and I want to make sure we have the best outcome each time.
After visiting All-Star Orthopedics, talking to Dr. Thomas and his staff, we learned that his team encourages patients to educate themselves and consider all of their options before doing any kind of surgical procedure. The patient gets to participate in their own health care, whether it's non-operative or operative management. All treatment options are presented in a clear and thorough manner to allow patients to make educated and informed decisions about their condition.
I feel like his patients leave here better educated with more information. They have the appropriate resources that they need. I think when they hear the term orthopedic surgeon, they think, surgery, but I would say we only do surgery on maybe a very small percentage of our patients. We try to evaluate each person separately and their condition, and take into consideration what their life goals are and their plans are. One of the first things we always ask are like, what do you want to go back to doing? Because our goal is trying to get them back to what they want to do with. We try to provide everybody with, several treatment options, surgical versus non-surgical, trying to get them back to their activities of daily living, making sure their quality of life is where they want it to be.
Among the many innovative non-surgical options available, Dr. Thomas is using stem cells. Stem cells are being expanded in medical treatments every year because of their regenerative properties to generate new cells in areas of need. Many doctors are calling stem cells the new medical revolution because it changes the way medicine is delivered and prevents invasive surgical procedures. Doctors are finding that stem cells provide great healing and new growth all over the body, from muscles, joints, hair, and even growing teeth. Today, we are excited to learn how Dr. Thomas is using stem cells for sports injury treatments as an alternative to surgery.
Another injection that has been getting a lot of press recently is a stem cell injection. And stem cells are cells that are generally found in one's fatty tissue, or what we call adipose tissue, or your bone marrow, the hollow part of the bone. And they're the cells that your body makes and stores and uses to regenerate tissue throughout your body in any given time in response to injury. They can regrow kidneys, they can regrow liver, they can regrow skin and hair. In our field, we're trying to see how we can get them to be used to regrow muscle and tendon and cartilage.
As we journey and find new frontiers in science and medicine, we will be there covering these advances. See you next time.
Precision oncology is a way of treating cancer that, although we know that the cancer is not curable in advanced stage, but we try to make it a chronic disease, something that the patient can live with and not die from it in a short time. We don't care really where the tumor is coming from, where the origin of the tumor is. The most important thing for us is what are the mutations that causing this tumor to grow. So when we identify those pathways or those mutations, then we try to find a medication that affect and can hit those targets and kill the cancers.
When we came over here and Dr. Javadi told me that I'm gonna start walking in 3 weeks. But first month, I was already walking myself, and everybody was happy.
The proceeding was a paid program that was paid for by Planet TV Studios.
The proceeding was a paid program. The opinions and views expressed do not reflect those of Bloomberg LP, its affiliates, or its employees.